Welcome to the Health Utilization Management training module. Before you get started going through each standard's requirements for health utilization management, I want to give you a broad overview of the way URAC looks at the way utilization management, or ought to be conducted. Generally, URAC thinks about this as a four-step process. The first step is called initial screening. It's handled by administrators, period. People with no clinical authority. If you've got a clinician in that position, that's fine. He or she simply cannot perform clinical functions. At this first step, it's all about gathering data, making sure all of the information is accurate and fits into whatever structured analytical tools your organization uses. If you've got a clinician that's not licensed, this is the place to put that person in the process, because after this, from steps 2 through 4, you've got to have some sort of clinical license. The second step is called initial clinical review. This is typically, although not always, handled by utilization management nurses. They've got to be licensed, and in some states there are certain requirements about what state's licenses, but URAC leaves that for you and your lawyers to sort out. For URAC's purposes, it simply has to be a valid current license, a clinical license. Typically, as I said, this is a nurse. At this point, clinical analysis can start to happen as to whether the treatment suggested is medically necessary. However, what's important to know at this stage is that it's absolutely prohibited for anybody at this stage to say, no, you can't have this treatment because it's not medically necessary. You can say, no, it's not a covered benefit, but not because of any clinical reason. And that's because URAC requires that no be handled at the third level, which is called peer clinical review, or peer review. That's handled almost always by a licensed doctor, either an MD or a DO. Now, it could be a licensed professional like a psychologist or a chiropractor, but only if the treatment is requested by somebody of the same licensure. In other words, a chiropractor as a peer reviewer could review the requested treatment of another licensed chiropractor. Same with psychologists. But if it's a doctor requesting the treatment, then it's got to be a licensed doctor that's doing the peer clinical review. And that leads us to the fourth step, which is appeal. Now, appeal has its own set of rules. There are about 8 or 9 standards that URAC applies to describe the appeals process, so read those carefully. But these two also need to be either a doctor or a licensed doctor or a licensed clinician of the same licensure as the ordering provider. But more importantly, this is where the specialization requirement comes in. It's really, in many cases, has to be specialty matched. Read those standards or listen to the videos very closely about the specialty matching requirement. So those are the 4 basic steps in utilization management. If you're in a health plan and you have one extra standard that talks about the 5th level of review, and that's called independent review. That happens after all of the internal reviews. The reviews that go on inside the organization are exhausted, and then there's one more review outside of the organization. And that's the 5th step. That's a requirement only for those going for health plan accreditation. So for most organizations, it's 4 levels. For health plans, it's 5. Those 4 levels, again, to summarize, are initial screening, initial clinical review, peer clinical review, and appeals. And that 5th bonus round for health plans is called independent review. Well, I hope the rest of the training is useful for you.